Booyah! This is Robin from Back Pain Secrets, and today's topic is common lumbar herniated disc symptoms. Common lumbar herniated disc symptoms. So you might ask yourself, what the hell are you talking about, Robin? What is lumbar and what is a herniated disc? Well, first, lumbar, that's the lower part of your lower back. So if you have pain in your lower back, and if you have a herniated disc, meaning the disc has cracked open, you have a bit of fluid that has run out, and the fluid is pressing on the nerve or nerve root, the nerve gets inflamed and you're feeling pain in your back, buttocks, down your leg, down to your foot, then you might have a herniated disc. And that's what we're all going to talk about today, okay? But before we get into all that, please subscribe to the channel so I can help you with back pain on a regular basis. So hit that subscribe button so you can get daily updates. Okay, so common herniated disc symptoms in your lower back. It's more or less what happens. It's common that a herniated disc is pressing against or inflamed a nearby nerve, causing the pain to radiate along the length of the nerve, okay? A lumbar herniated disc is the most common cause of sciatica. And you guys that have had sciatica, you know that you have pain in your back, buttocks, down your leg, down to your foot regarding that, So that's one symptom of a herniated disc. But a sciatica can be caused by other things as well. But a very common reason why you have sciatica is a herniated disc. So, first symptom, leg pain, right? So the leg pain is typically worse than lower back pain, okay? If the pain radiates along the path of the large nerve in the back and the leg. And it refers to as a sciatica or radiculopathy, okay? Then you have your nerve pain, okay? And the most noticeable symptoms are described as a nerve pain in the leg with pain described as sharp, okay? The pain is sharp, it's electrical, it's radiating, or even like piercing, okay? Piercing. So that's like if you have a pain in your leg and you feel it's really sharp and you have this electrical feeling to it, it's radiating and piercing. It can almost feel like electricity or a light of lightning, right? Like it could be struck by lightning, okay? And also another symptom is variable locations of the symptoms, okay? Depending on where the disc is herniated and the degree of herniation, if you have a big herniated disc or a smaller herniated disc, symptoms may be experiencing in the lower back, okay? The buttocks, very, very usual, front or back of the thigh, okay? The calf muscle, the foot, the toes, and typically affects just one side of the body. So usually when you have a herniated disc, usually it's on one side of the body. So you might have the right or the left side, but it's not uncommon that you could have like a central herniated disc, and then you will have pain in both of your legs, okay? Then you have neurological symptoms like numbness, okay? Pins and needle feeling, weakness and or tingling may be experienced in the leg, back, buttocks, foot, toes, okay? So that's a kind of a switch between these, like this sharp feeling like electricity, but you also have this numbness and a kind of a hard to explain feeling that you have in your back, buttocks, down your leg. Then you also have something called drop foot, okay? And drop foot is a neurological symptom caused by the herniated disc, may include difficultly lifting your foot, okay? Because this fluid that has run out from the herniated disc is pressing on your nerve or nerve root and sending less signals down to your muscles, down to your legs, so you can't lift your foot. So you have something called drop foot. So you're basically dropping your foot and you're like pulling your foot, okay? Of course, another symptom is lower back pain, okay? This typically of pain may be described as dull, throbbing pain. It may be accompanied by stiffness, okay? If the herniated disc causes lower back pain, muscles start to spasm, and the pain may be elevated somewhat by, or like if you're moving too much, that could irritate it, okay? But you could also reduce the pain by lying down shorter periods of time during the day. Also apply like ice or heat, and sitting in a supported recliner, okay? Best thing you could do when you have a herniated disc is not have one in the same position all the time. So you're moving about, you're walking, you're standing, you're sitting down, you're lying down. And when you're lying down, don't forget to put a pillow or between your knees, okay? Also pillow underneath your arms. That can actually help you to reduce the pain a bit, okay? Also, when you have a herniated disc, like I was talking about before, pain usually worsens with movement. So the more you're moving, the pain follow prolonged. Like if you're standing for a longer period of time, if you're sitting for a longer period of time, okay, or you're walking, even short distances, and very, very common and symptom also when you have a herniated disc is when you're laughing, when you have a good laugh or a sneeze, or like other sudden actions like that might intensify the pain. Also, like when you go to the bathroom and do number two, that's usually also a painful experience when you're sitting down, you're pressing out there, okay? So more stuff that can irritate your herniated disc pain. Well, pain that worsens when you're hunching forward, okay? When you're hunching forward. Many find that position, such as slouching or houching forward in a chair or bending forward at the waist, make the leg pain worse, okay? So whenever you're like twisting and turning and you're moving forward, that usually increases the herniated disc pain. More stuff that's very common for a herniated disc, like a lumbar herniated disc pain usually develops quickly, although there might be no like thing you can get it to. Many people say, well, what happened? Why did I get a herniated disc? I didn't do any like sports. I didn't do like, I wasn't in a car crash or whatever. What happens is that as we grow older, the disc actually gets drier and drier, and you have small cracks in it. And some people develop these cracks so much that the fluid runs out. Then of course, you can have like, if you're in the gym and you're doing like stupid stuff, too heavy stuff, you're lifting too heavy weights, like if you're doing squats, if you're doing deadlifts, if you're doing like extreme martial arts and stuff like that, twisting and turning and lifting hard, that's all like risk factors also that could irritate and create a herniated disc. So a lumbar herniated disc symptom are usually more severe if the herniated is extensive pain, can be mild and limited in the lower back if the disc herniated does not affect the nerve. So there's so many different layers when you have a herniated disc, okay? You can have a lot of pain, a little pain, and the pain can go up and down depending on what you do. So it can be quite confusing. And many times it is this like thing that it doesn't really follow a pattern. Some days when you're actually doing stuff and you're more active than you usually are, you feel better. And then some days when you're just lying down, taking it easy, not doing anything, then the pain intensifies. So it doesn't follow a pattern in that way. So it can be very confusing and frustrating. The good news is, however, guys and gals, is that the majority of back pain or herniated disc pain will alleviate itself within 6 weeks if you have it for the first time, okay? So even if you're in bad shape right now, you have problem like sitting, standing, walking, sleeping, all that, give it time, okay? Most back pain most herniated disc pain and back pain will relieve itself by itself. But if you're having like a drop foot, you can't lift your foot, if you have bowel movement problems, you might have something called caudic vein, and that's really important that you get in and get that checked out, because you might even need surgery quite quick to do that. Other stuff that you should be doing, and you guys and gals that are listening to this on a daily basis, walking. If you're not walking at least a 30-minute walk every day, if you have a herniated disc, you're not doing what you need to do. And I understand if you can't walk for 30 minutes right now, walk 10 minutes, okay? Start with 5 minutes and then work yourself up there. I would say, like in the majority of cases, and most people can actually just walk away the herniated disc pain if you do it on a consistent basis for a few months, okay? Also get a standing desk. I'm very, very prone to get a standing desk to get up. And I'm not saying that you should be standing all the day, okay? You should be standing short periods a day, maybe 30 minutes in the morning, 30 minutes after lunch, 30 minutes in the afternoon, okay? Do some core stability exercises, some breathing exercises, okay? Keep it simple, keep it like just do it consistently. And also, what can you eliminate? Eliminate stress, eliminate stupid stuff that you're doing at the gym, eliminate like all stuff that creates more irritation and irritation for your back for a period of time, okay? And you will beat this. I know you can. And if you're listening to this and you feel like all hope is gone, I'm telling you, there is hope there. The majority of people, 9 out of 10, will not need surgery if you have a herniated disc. That's the good news. So keep your chin up, keep on moving, keep on standing, and you can beat this, okay? Take care, God bless. And guys, remember, If you get some value from this video, okay, make sure to leave a like and subscribe. Leave a comment as well. I'm more than willing to answer any questions you have regarding your herniated disc pain, okay? So I can help you on a regular basis with you beating this herniated disc pain. Take care, God bless. And guys, remember, just one step away from reducing or even fixing your herniated disc pain. Bye-bye.